stand your punk ass up.
How would you like to be on the subway with this man?
Down, dude. Your party stood up. That's a threat.
Or this person? Or how would you have liked to have been in Denver the day this man terrorized people, swinging this pipe at them, hitting some? Later he said, "I didn't mean to hurt anyone. He only did this in self-defense," he said, because he felt threatened.
He was paranoid and he thought these people had been attacking him.
DJ Jaffe gave up a successful advertising career to try to improve the way America deals with people like this man. In jail later, the man apologized. He said,
"I'm sorry, and I didn't come here for nothing like that. If I was on the medication, I wouldn't have never done nothing."
Most of the disoriented and threatening people we see on the street are schizophrenics, or people with bipolar disease who stop taking their medication. They cycle in and out of hospital emergency rooms.
Jimmy, get out of the way! Call 911 again.
And some are a danger to others.
We have one officer that's correct.
Russell Weston shot 2 guards at the Capitol because he knew there was a ruby red time reversal system in the basement, and if he could get to that, he could save the world.
The ruby time reverse system means that they are not permanently dead.
Did you just make them come alive by your choice?
Yes, I can do that, yes.
Weston wasn't taking his medication because he didn't believe he was sick.
Almost all these cases are individuals who are known to be seriously mentally ill and not treated. Russell Weston was one of them. So was John Hinckley, who shot President Reagan. John Hinckley shot Reagan because he knew, not thought, knew that was the best way to get a date with Jodie Foster.
Years ago, more mentally ill people were locked up in mental hospitals, asylums. That protected us from people like these, but the asylums were horrible places.
They were overcrowded, very shabby conditions. So we decided we would largely replace that system with a system in which people would receive mental health care in the community.
Made sense. They'd be closer to their family, perhaps, who could visit, be cheaper in the neighborhood. But that didn't happen.
Nope, the largest jail or prison is going to have a larger population of mentally ill people than the largest mental hospital.
Today, thousands of mentally ill people are locked up in Los Angeles County Jail, Cook County Jail, and Rikers Island in New York City.
You will find a much larger population of seriously mentally ill people in those facilities than you will find in any mental hospital.
The guards are not trained in handling mentally ill people.
A jail or a prison is no place for somebody with schizophrenia. However, that's where they're going to remain.
As hospitals went down, incarceration went up. And in fact, in the 1960s, and you compare it today, there's virtually the same number of people institutionalized.
Just in jail instead of asylums.
Absolutely.
And in jails, they barely get treatment. And the mentally ill people in jails stay much longer.
And they get abused. And they get victimized, and they get thrown in solitary, and they can't visit their families. It's a horrific place to be.
There could be better alternatives. America has some high-quality mental hospitals. Bellevue in New York City is world famous. But Bellevue doesn't have enough money to give the extended treatment that most seriously ill people need.
It's become harder to get into Bellevue than Harvard. If you're well enough to walk into a hospital and ask for care, they're going to say you're not sick enough to need it.
If you are sick enough, as this man may be, hospitals often practice what Jaffe calls treating and streeting.
They discharge you sicker and quicker. It's basically treated and streeted is the new policy.
The police call it catch and release. Of course, there'd be more money for treatment of the repeat offenders if government didn't promise something for everyone.
There's something for everyone.
In New York, Mayor Bill de Blasio appointed his wife head of a program meant to address mental illness.
I am the First Lady of New York City.
Her program, Thrive, says 1 in 5 New Yorkers has a mental health condition.
Thrive includes 54 initiatives backed up by almost $1 billion.
But most of that money goes to people who are not very sick, writes Jaffe in City Journal.
They wrap anything that makes you sad, bad grades, poverty, coming from a single-family household, in a mental health narrative.
1 in 5 New Yorkers have a diagnosable mental health condition in any given year.
Blurring the lines between various mild mental disorders such as anxiety or mild depression and schizophrenia is not a bug, it's a feature of the program. The program is supposed to do that because it believes that the only way that New Yorkers will support improvements to mental illness policy is if they are convinced that everybody has a mental illness.
I'm not able to sleep at night.
Seems like I'm arguing with the people I love nonstop.
They're totally oblivious to the bigger problems.
20% fight mental health woe.
If you have anxiety, you're in that 20%. If we're going to spend all our money on people who are anxious or can't sleep, what's left for the seriously ill?
Not much. Thrive spends 80% of its money on problems like anxiety and loneliness. Money that Jaffe says would provide housing and basic treatment to more than half the seriously mentally ill and homeless. Mental health professionals want to help people.
No, they're focused on all the wrong things. If you ask any cop what we need, he's going to say, we need more hospitals, we need easier civil commitments so that when I bring somebody they're admitted, we need to keep them on their medications so they don't deteriorate. Now I go to a mental health conference. I go, well, we have to educate the public and we have to fight stigma. The ability to get care has become inversely related to need.
Why?
It's a much easier population to serve. They don't cost as much to help. Serving the seriously mentally ill is a really difficult task.
But let's say America did focus care on the sickest people. What happens if they then stop taking their meds? You can't force them to take the medication forever.
There are people who lack the maturity of their faculties, and as a kind and compassionate society, we should be helping them get treatment, not helping them go further into psychosis.
46 states now allow officials to order dangerous people into assisted outpatient treatment, which forces them to accept treatment, including medication. I would fear my government having the right to forcibly drug me. What if some psychiatrist doesn't like my politics? Maybe I'll get locked up.
Nobody can lock anybody up without extensive court review. But being psychotic is not a right to be protected. It's an illness to be treated. Making someone accept treatment can free them from the bastille of their psychosis. It's a reasonable use of the police powers of the state to help people who can't help themselves.
Helping people who don't help themselves before they hurt themselves or others, and helping them without just locking them away. That would certainly be more compassionate than what we do now.
We tend to think of ourselves as a very tolerant society, certainly very compassionate society, but a century from now, when people look at the situation with the seriously mentally ill people, they're going to look back on us and wonder how compassionate we really were.